Welcome to Section 4, Step 1. This is the first video tutorial of Section 4 on maximizing our earnings, and in this lesson, we're going to be going through how to secure a high-paying position. So first, what you need to understand about high-paying positions is that you need to look at what you're going to earn after tax. Earnings pre-tax can be deceptive, but that's not really what you're going to take home, and so that's not accurate when we create our debt-free monthly projection and try to match our debt-free goal. That's not actually going to be how we can match our goal. We have to discover what we're actually going to earn after tax. And the best and simplest way to do that is using the calculator by going to salaryaftertax.com/US. The links are below this video. And so that calculator enables you to really easily, you plug in your annual salary, you hit calculate, and then it gives you an estimation of your yearly and monthly earnings after tax. And this enables us to understand what we can take home monthly and then subtract that from our estimated monthly loan and debt-free goal to make sure that we have the proper cost of living that we need. So let's run through some numbers. So using that calculator that I talked about and the links below in the video, I plugged in $90,000 and $70,000. So if you earn $70,000, after taxes, you are only actually taking home $4,497 a month. Now, we, in the previous video, realized that we need to earn $4,333 to be able to achieve debt in 2 years if we have a $100,000 loan. That really doesn't give us much wiggle room. But if we take $90,000 after taxes, then we're taking home $5,619. That's a lot more wiggle room that we have for a cost of living. And so really, I recommend that you need to try to earn as much as you can. And to achieve the $100,000 in 2-year goal, you really have to earn roughly $90,000 or more. And so how do we actually earn that high wage? It's through these high-paying therapy jobs. And they are travel, contract, home health, and per diem. So I'm going to go through each of these different career routes and the pros and cons. So let's start with travel. So first, what is travel healthcare? Basically, you are hired by a travel company to work in X facility. You can travel near your home or far, but that's where the term traveling comes from, is that usually you're taking contracts nationwide. These are often short-term contracts, usually 13 weeks, but they can be in a variety of settings: acute care, subacute, pediatrics, really a variety of different settings. And so you're going from contract to contract to contract, potentially in one state or one city, and then moving to different places. Now, the average salary that a traveler can make is between $6,000 to $8,000 a month after taxes. Annually, that comes out to $78,000 to $104,000 after taxes. And that's really an estimate. It depends on your experience, your profession, and where you work. But what's really unique about traveling and why you can really earn so much as a traveler is the fact that much of your earnings comes from tax-free stipends for food and lodging. And that enables you to actually take home much more than the other positions that we're going to talk about in the next slides. Now, as a traveler, in addition to the high pay we talked about, there are several other perks you get as well that are unique. You have the opportunity for free continuing education, license and CPR reimbursement, as well as bonuses and sign-on benefits. But what is most important for this course is the fact that there is a travel company that pays you an additional $8,000 a year for your student loans on top of the generous travel wages that you already earn. So here are some more advantages. In addition to the amazing pay, there is unbeatable experience. And what I mean by that is that as a traveler, you can work in a variety of settings. So normally you would just have an experience with one patient caseload or one type of setting. But as a traveler, you can work in all the settings if you want to, and that is going to compound not only the knowledge and the patient care level of expertise that you bring, but also you are meeting more therapists and more people, enabling you to have a bigger amount of mentorship and knowledge compared to any other setting. In addition to the amazing pay and experience, you also have the opportunity for adventure and flexible schedules. Travelers can work as many or as few contracts as they want to, allowing you to have vacation or take more breaks than normal permanent positions. And in addition, what I really think is amazing is if you do decide to return to a permanent position, you can use your travel salary as a tool for negotiation and earn several $1,000s more using those wages to increase your hiring salary. There are some disadvantages. Travelers often have 13-week contracts. Now, these are short-term contracts, but you can spin that into a positive by doing different contracts and growing your experience. You can spin this into a positive by also being able to take breaks and travel as much or as little as you want to. There also is a disadvantage in terms of increased organization. You have to plan out your contracts. You have to make sure that you are communicating with your recruiter to enable you to get the right jobs at the right time. Now, travel is really my number one career choice for someone who's wanting to get out of debt for all the reasons I just discussed. And so besides this debt-free course, I have also created a travel mentorship program that I want to share with you. My mentorship program includes a 2-hour ultimate guide to travel therapy course, which is worth over $200. It also includes access to amazing recruiters so that you can get started traveling really quickly and easily and not have to do any searching or any discovery. I give you everything you need to be a successful traveler from day one in this program. You also get my support and assistance. So the link is below for this mentorship program, and you can also simply email me at debtfreept@gmail.com to get started and for me to provide you all these amazing resources as well. Now let's move on to contract. So what is contract healthcare? Contract is very similar to traveling. However, you work annual contracts. So you work for a facility, but through a contract company. But instead of the 13 weeks like traveling, it's often 1-year contracts. And in my experience, you can earn between $84,000 to $104,000 a year, but that is pre-tax. So your take home is likely going to be less as a traveler. However, it is still a great career route for you. Now, the advantages is that this is increased earnings compared to permanent positions. You also are able to work near your home. Now, with traveling, you can work near your home, but the tax-free stipends are formulated a little bit differently. And if you have any questions about that, feel free to email me. The disadvantages about contract is that usually it's an annual contract. So at the 1-year mark, you may have to find another opportunity. There is that risk that they won't re-sign you again to continue working at that facility. Now let's move on to home health. Home health is essentially where you drive to different patients' homes. You normally see about 6 to 8 patients a day, and they're 30-minute treatment sessions. This is normally working with a geriatric or post-operative patient caseload. And usually, in terms of permanent sector, home health is the highest earner, and there is a potential to earn $100,000 or more pre-tax as a home health worker. The advantages of home health, besides the amazing pay and the best pay you can get in a permanent sector, is the fact that you get one-on-one treatments. So you're working individually with the patient. There are no other distractions. It's just you and the patient. There's the potential for increased earnings. There's also the potential for flexible schedule. You call up the patients and you actually create a schedule that fits with them. So say you have a doctor's appointment or have to pick up your daughter from school, you can make that work often with your home health schedule. And then lastly, if you are an independent practitioner, then this is a great opportunity for you because you are really able to fly solo and treat patients on your own accord. There are disadvantages, however. Home health is notorious for having a lot of paperwork. There's also increased responsibility and reduced guidance. So if you're a new graduate, home health may not be the best career option for you. There also is a chance for high productivity demands. Lastly is per diem. Now, per diem isn't really a high-paying job in itself, but more as a high-paying adjunct to the other positions we talked about or to a standard permanent position. So, what is per diem? It's essentially where you work as needed in different facilities. You normally work 1 to 2 days a month, and it's usually on call or pre scheduled work. These can be in a variety of different facilities and settings. The hourly rate for per diem is normally between $45 to $65 an hour or higher. That means that in just one day, you can easily earn between $360 to $520 a day. If you did this every month for just one day, that means that over the year, by just working an extra day a month in per diem, you'd have between $4,320 to $6,240. Now, I want to give you a super awesome and secret tip here is that if you're a per diem worker, try to prioritize working holidays, night shifts, and overtime because that enables you to get time and a half. So, for example, if you earned $60 normally as a per diem therapist, that means that if you worked night shifts or holidays, you would earn $90 an hour. That's so much more than $60, and that really adds up over the course of the year. And that means that's that much money you can funnel to your debt to conquer your debt so much faster. The advantages of per diem, beyond just the pay, is the fact that it's very flexible. You can work when you want to. It also has increased mentorship and the ability to build your resume. For example, if you don't have any acute care skills, you could seek a per diem job in acute care and grow that skill. It's also simply more therapists, more healthcare professionals for you to work with and talk with. You also are building new skills and its ability to compare settings. So if you're not sure what you want to do as a new graduate, getting a per diem job is perfect because you are getting to see how it really is working in that setting. And lastly, you as a per diem worker often get first dibs when they have new full-time positions. So if you're interested in working in a certain facility that right now doesn't have a full-time position, you could try to get a per diem job and then work into a full-time position there. The disadvantage of per diem is the fact that you do have the risk for increased burnout because you simply don't have as many recovery days. So in summary, here are the highest paying jobs out there for you: travel, contract, home health, and per diem. I really, really encourage you to try to seek out traveling, as that is my number one option, because not only do you have an amazing pay, but you have the flexibility and the ability to grow your knowledge, grow your experience, and become that much more amazing as a clinician. In the next section, we're going to be talking about cost of living and how to find the most amazing places to help save you more money as you try to become debt-free. So I'll see you in the next video.